Hey, it's great to hear that music on this Wednesday afternoon. That means it's the start of Helping Seniors of Brevard. Hi, everybody. I'm John Harper. Let's get the show underway. The host of the show and the executive director of Helping Seniors of Brevard is Kerry Fink. Good afternoon, Kerry.
Hello, John Harper. Hope your day is going good. It's another great Wednesday, and we are here with the Helping Seniors radio show right here on 90.3 FM WEJF. And it becomes the lunchtime gathering every Wednesday right here on the radio. So on behalf of Joe Steckler, our president and founder, and the entire Helping Seniors team, welcome to the show. And also a special welcome to those who tune in online at WEJF.net. And also a shout out to those who will be listening later, because every one of the Helping Seniors radio shows also becomes a podcast. And not only does that make it available on YouTube, on our YouTube channel, just Helping Seniors of Brevard, but our Facebook page as well, which is Helping Seniors of Brevard, and of course on our website, helpingseniors.brevard.org. But now, actually, since last week, there's even more ways for you to access our podcast, because we have literally just gotten onto, so if you're in your car and you have Apple CarPlay, you can hear our podcast now on Apple iTunes. If you like Alexa, you can get it on Amazon and Audible. If you use Google, you can go to Google Podcasts. If you choose iHeartRadio, we're there, and same with Spotify. All you have to do at each one of those locations is look for Helping Seniors Radio. That's the name of the podcast, Helping Seniors Radio. And so we want to welcome the audiences that are joining us literally globally for that. But right here at home, as you know, Helping Seniors of Brevard, now in our 11th year of service, we are a homegrown, local, charitable organization founded by Joe Steckler. And one of the people who has been kind of like right by Joe's side all the way through is none other than our special guest today, Dr. Lee Sheldon. How are you today, sir?
Hi, Kerry. Great. How are you?
I am excited. We have so many fun things to talk about on the radio show today. I know the serious part of our radio show is going to be titled on the topic. You're a noted area periodontist. You have the practice called Solid Bite Dental together with your son, Dr. Matt Sheldon, and also periodontist Dr. Sheldon Furtado. And the topic of our show is actually going to be, what are you hearing about root canals? But I want to get...
Oh, that's serious stuff, let me tell you.
Well,
Stay tuned for what you're hearing about root canals. You never know what I'm going to say.
Well, that's true. And as the person who actually got Joe Steckler started in radio, well, TV, I think it was John Harper who kind of got Joe started in radio. In fact, for years, other than John Harper, we've called Joe Steckler the longest running radio host here in Brevard County. But I think you got Joe started in TV all those years ago.
I got Joe started in TV, and John got my son started in radio. So there's a nice connection here.
It's all good. And so here we are. If you think about it, I know that with you and John, all this predates Helping Seniors, which Joe established in 2011. So here we are in 2022. But before that, Joe built those Joe's Clubs as part of Brevard Alzheimer's, and you guys helped make all that happen. But some exciting things going on with Helping Seniors that I want to share before we get into the meat and potatoes of the show. The first of which you already heard, which was our big announcement that we are now officially podcasting again. If you want to check out the locations, there's links. You can go right there at helpingseniors.brevard.org/podcast, and it will have links that you can get over to the Amazon podcast site, the Apple iTunes podcast site, Google, iHeartRadio, Spotify. And so lots of ways to access Helping Seniors on the go. And one of the things, Dr. Sheldon, that I've noticed along the way is that not only do people enjoy hearing the shows while we present them, live, if you will, but also that sometimes something will catch somebody's attention and then they want to share it with a family member. Maybe there's another family member that's going through or could benefit from the information that's being shared. And so this is a great way that folks can search things out by content. I want to know about root canals or whatever, and then they can go and look that up. And I think that's one of the benefits of the information that Helping Seniors provides. So that's news item number one. And Dr. Sheldon, you've seen it progress from AM to FM to online and to the world of podcasts. It's come a long way, baby.
Yeah, what a difference from when we started. Absolutely right.
Yeah. Well, the second thing that I wanted to remind everybody is we are still in the middle of what we call our annual fund drive. Helping Seniors is a not-for-profit, and people assume that there's all kinds of grants and things like that to support the work of nonprofits. That is occasionally true, but for the most part, what happens for Helping Seniors is we rely on your direct support and the support of those businesses that support the work of Helping Seniors. So once a year, Joe sends out a letter, and it's basically where we're asking for your help. Since Joe formed this organization, we've helped more than 4,000 families free of charge for our Senior Information Helpline. That's that free call at 321-473-7770, 321-473-7770. And when you donate to Helping Seniors, you are making sure you're paying it forward, paying it back, however you want to look at it, but you're making it possible for seniors and their families to get good, solid information that helps them in whatever situation that they're in. And I got to tell you, we've been getting a lot of crisis calls, Dr. Sheldon, everything from housing to medical, there's all kinds of things. And oftentimes just having that person that knows where to turn in that moment can really make a big difference for a family going through some kind of trouble. So when you support Helping Seniors, that's what you're supporting. And there's several ways you can do it. You can go to Helping Seniors of Brevard.org/donate and safely, securely donate online. If you want to call the Senior Information Helpline, Nancy Deerdorf, our operations director, will be happy to help you either take a donation by phone, or if you prefer to send in a check, there's a way to do that. But it's a good time to do the annual enrollment. And Dr. Sheldon, as we're talking about fundraising, it would be terribly remiss if we didn't talk about the great program that you guys have helped us with for years that's really a benefit to the patients who end up coming into your practice.
We just love that program, Kerry. It's just such a benefit. So it's very simple. You want a dental examination. You want what we think is going to be the best dental examination you've ever had, with even our sign says no pressure. It's funny, we had we get reviews, and one of the common themes that we get in our reviews is they don't put any pressure on you to make a decision on anything, which I suppose is, I guess it's unique. So, or at least it's not as readily found as it might be. So if you want a great 2-hour examination, no, you won't be in the chair for 2 hours, but it'll be 2 hours of evaluation with x-rays, CT scans, all of the modern technology, so we can talk about your present as well as your future in dentistry and what you can expect. Then all you have to do is make an appointment, call our office, 321-259-9980, 321-259-9980. Tell Jennifer you're coming in via Helping Seniors. She'll know what to do. She'll talk to you about how you are going to make the appointment. You'll come in, you'll bring a check with you. You'll write a check for $50 or more to Helping Seniors of Brevard, and you'll get the entire examination, including all the x-rays at no charge.
See, what I love about that is that fits the whole theme of the annual fund drive, because here we are in January of 2022. We've all made our New Year's resolutions, the things we want to accomplish this year. This is a great way to swing one bat and get several things done that's probably on your list anyway. Number one is you're going to be helping a great organization. We can't do this without your help. Helping Seniors of Brevard, Florida 501c3. So depending on how you do your taxes, your donation is deductible and all that kind of stuff. But also, you're going to do yourself a big favor because you're going to get off on the right foot as far as it goes with your mouth health. And Dr. Sheldon, as we've talked show after show after show, oftentimes the mouth is kind of a lead-in for a lot of the other health things that are going on in your body. So to me, there's a lot of reasons. We've titled 2022 as the year of getting your ducks in a row. That means we're going to take care of all those things that we've been putting off so that we can age well and do the very best we can as we go forward in 2022. And I know that's an important topic and near and dear to you too, as we've talked about. This mouth health has so much to do with the rest of your body.
It is. I just saw a patient just now, just before this program, who has a sinus infection directly as a result of an infected tooth. But the relationship between the diseases that we have in the mouth and the rest of the body are very well known, whether it's heart disease or diabetes or Alzheimer's disease, among pulmonary disease, liver disease. There's a host of problems that occur because of that bacterial feed, that comes from the bacteria under the gum line that goes into the bloodstream and affects many of the other organs. In fact, most of the organs that haven't been studied. So yeah, it's important to make sure that the mouth is non-infected, and if it's non-infected, then that is going to improve your opportunities in the rest of your body as well.
No doubt. And maybe that's a great point. But by the way, folks, stay tuned because we have a really exciting announcement we're going to share with you. It's going to be one of those you heard it here first kind of news announcements right after the mid-show break when we come back with that. But let's go ahead and dive into this topic because, I was laughing actually when I saw the topic for today. What are you hearing about root canals? Because, Dr. Sheldon, to be honest, root canal is one of those euphemisms for anything that you would vote least likely I want to get done, right? You always say, I would rather do this than have a root canal, and I'm sure you've heard that before.
I have. We don't do root canals, which is very interesting. We're talking at a topic that we don't do. We don't do. Why don't we do it? Why don't we do root canals? Many general dentists do root canals, and the answer is very simple. Endodontists, root canal specialists, do a better job on average than the general dentist does. Now, I'm sure some general dentists are listening right now, and they'll be calling me saying, I'm not saying all general dentists do bad root canals. That's not the idea. But if you're looking on average at the person who's trained and the person who does it every day, that is a specialist called an endodontist. An endodontist has special equipment, has training, and does it every minute of every day. And so your opportunities for a more complete root canal and the whole idea of success with the root canal has to do with the cleanliness of the root canal. We'll explain a little bit more about that in a second. But the cleanliness of the root canal has everything to do with whether that infection is going to stay under control, whether that pain is going to go away, or whether it's going to continue.
Wow. So I guess the opening statement is kind of like, we hear this term all the time, and most of us barely know. We understand somebody says you've got a cavity, but somebody says, you need a root canal. Why would that be necessary? I mean,
why would you need a root canal? So this is difficult. We're on radio. I can't draw pictures. So I want you to picture a tooth and then a root. So you can all see a picture of a tooth and a root. Now, I'm not saying root canal. I'm talking about the part that goes under the gum line, the root itself. Within that root, there's a hollow tube. And within that hollow tube are blood vessels and nerves. That hollow tube, the name of that hollow tube is a root canal.
Ah.
Now, it's also interesting that if those nerves and blood vessels become infected or become painful, we remove those blood vessels and nerves, and the procedure is called a root canal. Very confusing terminology. So you've got this cylinder, that's a little tube going through the center of the root, going from the top of the root down into the mouth, and that cylinder is called a root canal, and then the procedure to take all the dirty stuff out of that inside of the canal is also called a root canal. Very confusing, isn't it?
Yeah, so you're actually rooting or root canaling the root canal. Am I saying
You're
that
root
right?
canaling the root canal. Good point.
Wow.
Yes. So why would you need it? If you have a cavity and that cavity comes close to where the nerve is, the cavity itself has bacteria in it. That bacteria then goes through what is the tooth structure overlying the root canal, and that bacteria goes through that and actually infects the root canal itself. You often first feel it as pain. Some people don't, but you often first feel it as a toothache. It's
Wow.
at that point that bacteria has inflamed the nerve enough that the nerve is saying, ouch. Now, sometimes all we have to do is remove that bacteria, remove the decay, put a little bit of medication over the area where the nerve is, and the nerve will heal. That happens sometimes. But more often than not, that bacteria goes so deep and the infection has gone into the canal itself that you have no choice but to remove the contents of that nerve, or as you said, the root canal. Take the contents of that out, so that the toothache goes away, or if it's advanced, to stop the infection that's occurring at the end of the root within the bone as a result of that bacteria feeding right through the canal, right to the end of the canal, and then eating away the bone at the end of the canal. That's better known as an abscess. So by thoroughly cleaning the inside of the canal, the body then will heal. And so that area where there is an abscess or a dark space or a loss of bone support in the area at the end of the root, that will heal up as a result of a successfully done root canal. And that's how we know that a root canal is successful. If we see a dark area at the end of the root, and then we see the root canal specialist, the endodontist, and that endodontist removes the contaminants of the inside of the canal, we can take another x-ray 4 to 6 months later and we'll see that area of bone has healed. If
Wow.
it does heal, we've got a successful root canal.
Well, that seems like fairly complicated. So what you're saying, if I'm hearing this right, I'm thinking a lot of times that, you show up at the dentist's office and you have mouth pain and you think, well, I must have a cavity. But what could very likely be the cause is something that's going on down there in the root canal. And so if you just took care of the cavity, you wouldn't necessarily have solved the problem.
Correct. That's why we would rather see cavities before they become painful, because once they become painful, then it's a more complex process to get that root canal cleaned out, and often you need to put a crown on the tooth. So this is one case where if you catch something early, you can minimize the damage to the tooth and minimize your cost in the dental chair.
Well, again, this kind of feeds right into the thing that we have set forth as our kind of goal in 2022 is to help everybody along. Joe has always talked about an aging plan. And in that, what we're talking about is doing the things that put you ahead of the curve instead of reacting or having to deal in crisis mode. So here's one more example as we talk about getting your ducks in a row, kind of our lighthearted look at that theme of getting organized. This is another reason why you want to stay on top of this, isn't it?
It is, I know, cost of dentistry always comes up, and there's some people say, well, I can't afford a root canal. Well, before that area becomes infected, or if that area has become infected, the other choice would be to take that tooth out, which is less expensive. Now, there are downsides to removing teeth that can't be saved, but if we're talking about preventing infection, preventing infection from spreading beyond the tooth into other parts of the body, then extraction is another way of going in order to be able to take care of that toothache or to take care of that infection.
Well, now here's another thing. I'm looking at some of the notes that you put together ahead of the show, and then it says that actually sometimes you have more than one root per tooth.
Yeah, now that's interesting. A front tooth has only one root. By the way, sometimes that one root, Kerry, has two canals.
Huh.
So there's a person will come in and say, well, I had a root canal done and I still have a toothache. The question might be, did we find all of the canals in that tooth, in that one single root? So that's the front tooth.
Wow, we're almost doing a tongue twister here, because now you have to find the right root to the right root canal to do the root canal.
That's true. And that's why the every endodontist that I know, I think every endodontist I know, now is using a surgical microscope so that when they're looking at the inside of the tooth, they can identify where those extra canals are. And there are far more extra canals than we previously realized. Now, in a back tooth, the back tooth has more than one root. Bicuspid might have two roots. A molar might have 3 roots. And within each of those roots, there's at least one canal. But sometimes within those roots, there are 2 canals. I just had a patient just before I came up here who had 3 canals in one single root.
Wow.
So the diagnosis is really important. The ability of the person, and I mean the endodontist, to be able to diagnose, to be able to see all of the canals and get each of those canals clean, is really the difference between success and failure of a root canal procedure.
So in many ways to think through this, when we talk about a root canal, it's actually, I guess, one of the objectives. Obviously, we're trying to get the patient out of pain, but we're also trying to get them, I guess, more healthy in that area. But at some level, this is also about saving the tooth, right?
Yeah, it is about saving the tooth. You cannot save a tooth that's infected, and of course, you wouldn't want to save a tooth that's painful. So it is a matter of removing the pain, removing the infection, so they have the opportunity of saving the tooth. For us, as surgeons, our decision goes to whether it's more effective and more predictable to save the tooth via a root canal or to extract the tooth and put in a dental implant. So when I'm seeing a person in my chair, then I'm saying, all right, I put all the factors together that I expect, everything I see now and everything I expect to occur over the next 5 or 10 years. I look at that, and then I decide, is it better to save the tooth or is it better to extract the tooth? More often than not, particularly, and we do dental implants for a living, more often than not, I will choose to save a tooth via a root canal than extract the tooth and put a dental implant in.
We've actually done shows. You've done TV shows. You've done radio shows where we talk about this, and I always think it's kind of fascinating to me that really, as a periodontist who kind of introduced dental implants to the whole Space Coast area all those years ago in your practice, that you actually also take time out to say that's not always the right answer. In fact, we've done TV shows and radio shows called "Are Too Many Teeth Being Extracted?"
Yeah, and that's one of our biggest problems. And as you know, as a matter of fact, a group of 5 of us from all over the country, have just published what we hope to be a major paper on saving teeth and the importance of saving teeth. And this is from a periodontal disease perspective, because there are far too many teeth being extracted, period. There's this romance that, oh, my teeth are bad, but root canal, but implants are perfect. Listen, implants are great, but they're not as good as the natural tooth. And so we've got to be, the pendulum has swung too far in the direction of dental implants. You have a minor problem, there's a tendency to extract the tooth and put in a dental implant. And the answer is, no, we've got to look at this and understand the capability of our capability to be able to treat teeth and be able to treat teeth effectively and to be able to keep the tooth, because dental implants can have their problems too, and so we want to weigh those problems and decide which is going to be the lowest risk for you, and then based on that, make that decision. The younger you are, the more likely we are also to say, let's save your tooth, than to do a dental implant. Because if you get a dental implant in your 30s, you're likely to get another dental implant sometime in your lifetime in that same area.
Wow. Well, yeah, and that's why all this information, listener, is so important. We're talking with Dr. Lee Sheldon, a noted area periodontist who is actually, I would actually call you kind of nationally, internationally renowned, because one part of your career has been helping other periodontal practices learn how to do the best that they can for their patients that they're seeing, literally all across the country, and helping them get it right for their patients.
It is. We just had a case conference last night with people all the way from Vancouver to Atlanta who were part of that case conference, and we went over it. And this group who essentially published a paper on how to make decisions with regard to periodontal care. These are, I'm not a top researcher. I'm known, but I'm not a top researcher. We have top researchers and top clinicians, 5 of us from San Diego, Phoenix, Kansas City, I'm missing one, and me, and we all got together in order to be able to disseminate standards of care, the way the standards of care should be delivered, and how periodontal care should be delivered in 2022 across the country. We hope that the guidelines we made up or the decision points we made up are simple enough that it can be broadly disseminated, broadly taught, and get more people saving more teeth all over the country.
Dr. Lee Sheldon with Solid Bite Dental. And if somebody is going to connect with you, maybe to get an appointment or to maybe just continue the conversation about all this, how do they get in touch or maybe take advantage of that great opportunity to have a comprehensive dental exam? How do they get in touch with your office?
Call our office at 321-259-8000, 321-259-8000, and just say, I heard Lee Sheldon on Helping Seniors, and I want an examination, and we'll take care of the rest.
Well, that sounds terrific. We're going to come back on the other side of the half-hour break, and we're going to have a big announcement coming up for you that's going to be exciting. It has to do with, well, I can't tell you, or it'll spoil the surprise. So see you in a few.
And it's Wednesday afternoon. You're listening to Helping Seniors of Brevard. I'm John Harper. Let's get back into the show with the host of the show and the executive director of Helping Seniors of Brevard. Here's Kerry Fink. Kerry?
Hey, thank you, John Harper, and welcome back to the second half of our lunch hour right here on 90.3 FM WEJF Radio, 30,000 watts, just blasting up and down the Space Coast of Florida. We actually thank the listeners that come in actually as far away as from Orlando and down in Vero Beach and all the way up north there in Mims. So thanks for listening, and also welcome to those listening online at WEJF.net and those who are catching this as a podcast later. On behalf of our president and founder, Joe Steckler, we're so excited to be back for the second half of the radio show. We have been talking about root canals with our expert, Dr. Lee Sheldon, who is Sheldon and Furtado dental practice. Many people know it by Solid Bite Dental, but right there on Sarno Road in Melbourne. And we're going to continue that conversation. Welcome back to the show, Dr. Sheldon. How are you?
I'm okay, Kerry. How are you?
Good. I'm excited.
You've got some exciting stuff going on there.
I have to tell you, we talked a little bit in the first half of the show. As a nonprofit, you really do fight for your survival because in a business, I guess you do fight for survival too, because you have to do good business if you're going to stay in business. But the same is true in a nonprofit. You have to do a good service, but you also are always busy making sure you have the help to be able to pay for the good service. And so for now going into our 11th year, we've provided the County Senior Information Helpline at 321-473-7770, 321-473-7770. Doesn't happen without your help. And so we talked a little bit at the beginning of this show about the annual fund drive where Joe Steckler, our president and founder, he's a retired Navy captain. His last command in the Navy was the Navy's retirement home there in Gulfport, Mississippi. And he and his wife, Terry, they retired here to Satellite Beach area of the Space Coast. And Joe couldn't stay retired. So the first thing he got busy doing was helping develop good resources for people with Alzheimer's. He set up and really was part of getting everything rolling with the Brevard Alzheimer's Foundation, which today they still call them Joe's Clubs, 3 locations throughout Brevard County. But then I remember when I met Joe, which is probably maybe almost 12 years ago now, and he was talking about, he goes, Kerry, he said, people have more needs as we get older than just memory issues. He said, and we need a nonprofit that will help in those areas. And so the job of that senior information helpline has been to help families, oftentimes in moments of crisis. And so at that number, 321-473-770, we've helped more than 4,000 people and their families to date. And we're looking forward now to our second decade of service here in Brevard County. And so we need your help to do that. One of the ways that Joe has been very effective at fundraising in the past, together with his longtime friend, he's the car dealer that has literally one of any car that you might think of. His name is AJ Hires. He's the guy that's always coming on TV telling you about the great deals that you can get at Boniface Hires car dealerships, and he's always the one that's polite and says, thank you. And so AJ and Joe go way back. And when Joe was trying to build the Joe's Clubs, they came up with a good way to have a fun way to do a fundraiser that kept the organization going and growing, but also was fun for people to get involved with. And that's a car raffle. And I think when we were all together last October at the American Muscle Car Museum doing the grand drawing for the 2021 Helping Seniors Car Raffle, I think Joe or AJ, one of them mentioned that together they've auctioned off over, or raffled off, I think is the correct term, over 35 cars. And so here we go. You're hearing it first here today on the Helping Seniors radio show. We are officially approved to get our 2022 Helping Seniors Car Raffle underway. And so there's a couple of things that you want to know. The most important one is that this could be your chance to get a brand new 2022 car from the Boniface Hires family of car dealerships. And basically based on prior demand, and everybody loves it. We've gone to each one of AJ's fine dealerships and said, would you put up a car, and we'll let the winner at the end of this, whoever wins gets to pick which car they want to win. And so now this will be our 6th annual Helping Seniors Car Raffle. And so the cars that you will be able to choose from is a 2022, backed by popular demand, it's always a favorite of the crowd, the Chevrolet Camaro.
I want that one.
Okay. Well, see, there you go, right off the bat. And then the 2022 Dodge Challenger. And
I want that one.
Hey, I'm with you. You know, what's so funny, Dr. Sheldon, is this has really become like the rivalry, right? So you're a muscle car fan, you're on one side of the fence or the other. Actually, I'd be happy with either. But typically people are either Camaro fans or they're Dodge Challenger fans, and they love to kind of razz each other. It's almost like a football rivalry, to the point that now for several years running, we've had a Dodge versus Chevy challenge where we've asked some of the folks that are part of the Helping Seniors team to put on their little sunglasses, driving gloves, get out there and put these cars through their paces at Mark Pylock's track right there at the American Muscle Car Museum. And it's always a hoot. It's so fun to watch how it turns out because, everybody is trash talking the other car. But Dr. Sheldon, what's so funny is there's 2 other cars in the Helping Seniors Car Raffle because AJ also has Boniface Hires Mazda, and they put up the beautiful Mazda Miata convertible, which is, I think that's a very fun car just by itself. Yes, and then he also has the Kia Superstore right out there on US 192, and Justin Jarek, who's the general manager there, they put out the Kia Sportage. And here's what's so funny: if you follow the history of the times that we've done this model of you pick which one of the 4 cars that you would choose to win, the Camaro, the Challenger, the Mazda, or the Kia. So the first year, the winner that we had those cars, the winner said, no, I want the Challenger. And she won the 2019 Challenger. In fact, she brought it out last year to several of the events just to show off the car. The year before, then the winner chose the Chevrolet Camaro, and actually he decided to upgrade it to a convertible, go figure, which seems like a cool idea too. But last year, much to the dismay of the Challenger and the Dodge fans, but for those of us who have a practical side, the winner, David Owenahowski of Orlando, Florida, he ended up choosing the Kia Sportage. So now, Dr. Sheldon, what is our winner going to pick in 2022? They've got these 4 fine cars to choose from.
You know, you're not going to lose on any of these. They're all beautiful cars. And they're all sharp.
They are so much fun. We get to, one of the perks of volunteering and helping out and helping seniors, we get to go out to some of these events. You know, they have car shows, and we'll get to take these cars out, and they are so much fun to drive. They are the state-of-the-art cars. They have every modern feature that you can think of that you'd want to see on a car, and it's just fun to have them out there. But somebody is going to get keys to a brand new car. And this is the other thing that you want to jot down as you start thinking about your choice of car, Camaro, Challenger, Mazda, or Kia Sportage. You're also going to want to mark down this date because it has become a fall tradition here in Brevard County. Mark Pylock, who is a generous benefactor, he's the guy that's actually built those dog parks around the county as well, so that you can take Fido out and have a great time. But he is also the owner of the American Muscle Car Museum, which is that $75-80 million collection of fine vehicles. It's basically his personal garage, but he is kind enough to open it up and let us have our Helping Seniors Car Raffle event there each year. Each year just seems to get bigger and better. Last year we had almost 2,500 people out there. It was a huge event. So much fun. Great food, great cars, just a great time. And we got to actually be there when we pulled out the winner of that car for last year. So this October, you want to write down the date, Saturday, October 8th, 2022. Saturday, October 8th, 2022. That's the evening. We're going to be back at the American Muscle Car Museum to pull this year's winner. So stay tuned. You're going to be hearing about tickets and stuff probably starting about the 1st of February, but you heard it here first. So you can already start dreaming about what your new 2022 car is going to be. So what do you say to that, Dr. Sheldon?
Exciting. So, and look you've got all this time to just buy a ticket a month, maybe buy a ticket a week in order to be able to improve your chances of winning one of these 4 cars.
You know, that is well said. People often ask, if we're out at an event, they say, well, how many tickets are in there? And so what we always explain is if you ever go to when one of the fast food restaurants has their little contests, and if you ever look at the back of the little ticket or however those things work, and your chance is like 1 in 800 bazillion or something like that.
Right.
Or even when you look at, lotteries that the states have, they talk about Powerball jackpots and things like that. And, your odds are infinitesimal. But here, it's a local charity, so you're competing with a few thousand people, and it's just a whole different game. So first of all, when you buy that ticket, you're really making a donation to Helping Seniors and allowing us to carry the work of helping seniors going forward. But you're also then giving yourself a chance to have a really actually fairly decent chance to win a new car. And I always tell people, it doesn't matter. You're going to win anyway, because if you're in town, while you don't have to be present to win, there is nothing like that evening at the museum. It's just a great night out with last year, Mark provided all the food and everything, the beer, the wine, everything is included. So you show up out there, you just have a great time in the museum. He said he's up for that again this year. So we are so appreciative to Mark Pylock. Every year that his museum has been open, he has been so generous and kind to make that available for the Helping Seniors crowd, because he said, listen, I want to do something that helps you guys do your work in helping seniors. And you can't get much better than that. So October 8th, don't miss it. So
October
Dr.
8th. Yes, I got to be around here October 8th.
Yes, put that out. You got Plenty of time to put it on your calendar. Well, let's jump back into this conversation because I opened the show with this thing that it's often the thing that we say, well, I'd rather do that than have a root canal. And yet that's our very topic today is about root canals. But in case somebody missed the early part of the show, can you do a quick recap? We all have this idea root canals are painful. We don't want to deal with it. But what is a root canal?
Okay, so root canal, if we take a look at a tooth has a hollow tube going from the top of the tooth to the bottom of the tooth, a hollow tube within the root itself. Within that root, there are nerves and blood vessels. A lot more blood vessels than nerves. You know, we think about nerve all the time. I hit the nerve, whatever it is. But that is where that canal, that hollow tube has these blood vessels and nerves. Those vessels and nerves can become painful or they become infected or both. So a root canal procedure is to remove the contents of that canal, clean out that canal, remove all the contents, and fill that canal up with a filling material that will then seal that tooth off from the outer environment.
You know, as we're talking about that, the other thing that I learned in the first part of the show that I didn't understand until you explained it was not only is the procedure called a root canal, but you're actually doing the root canal on the place of your tooth called the root canal.
Yeah, talk about confusing. You know, someday we'll talk about crown. There are actually 3 different definitions of crown. I don't understand why we don't get our terminology better, but yeah, you do a root canal in order to be able to remove the contaminants within the root canal.
Now, as we've talked about this, well, first of all, I guess if you've been through a root canal, you probably have your own understanding of it. But if you haven't, because it's become so generically used as a painful kind of thing, are root canals painful?
They don't have to be painful, and it's the same thing we talked about it earlier, and it bears repeating. The greater the level of expertise of the person who's doing the treatment, the better the opportunity not only for that treatment to be done well, but also for that procedure to be done comfortably. So, for example, I will be the first to tell you, and I'm not embarrassed to tell you, that if you have periodontal disease, you should be seeing a periodontist. Okay? I don't have any hesitation about saying that. If you need a root canal, the person who is best trained to do that root canal, who's got the equipment, who has the expertise, who has the training in the background, is the endodontist. The endodontist is the specialist who does root canals.
Okay. And so
then your opportunities then, can something be painful? Everything can be painful. What you're trying to do is to minimize the pain or remove the pain entirely from a procedure. That's what we want. We don't want people going through pain in our offices. None of us do. It's a root canal specialist who's the most likely person to be able to do the root canal procedure painlessly.
Well, and we talked about this a little bit too, right? Is that a lot of times we'll come in and as a consumer, all we know is my tooth is hurting. And then what you've explained a lot of times is that it may not necessarily be the cavity, but it is actually the stuff that the cavity is allowed, am I saying this right, the bacteria to get down in the root, and maybe that's where the pain is actually coming from?
It's true, because the cavity goes so deep that the cavity keeps on traveling from the outside of the tooth to the inside of the tooth. Well, what's in the direct middle of the inside of the tooth, and that is the nerve or the blood vessels, which are within the root canal. So the deeper the cavity is, the more likely it is to hit or come close to the nerve and cause pain or ultimately cause infection in that area.
And also in the first part of the show, another factoid, I guess, that you can amuse and astound your friends at your next party or something that you're at. I did not understand. I assumed each tooth had a root. or a root canal. But as we've talked about, tooth sometimes can have more than a root canal. And so I want to frame that in this question to you, though, is so if the doctor says you need a root canal and they're correct and that's what you need to do, how do you ensure it's successful, or what are the things to look for? What makes a good root canal versus a not so good one?
Well, one thing is the canal has a certain length. In other words, the canal goes from the part of the tooth that you can see all the way to the end of the root. So one part of it is to make sure that the entire root, the entire length of the root, is cleaned, that the dentist actually reaches to the end of the root. The second is that root canal has a certain width to it, and within that width or within that channel, there are contaminated contents. The more thoroughly the person removes the contaminated contents, the better the opportunity for removal of infection. Now, these days, it isn't just instrumentation. It is the person who's using the instrument, and now we have additional technology. Some using sonic waves in order to better dislodge all of that organic material, that those blood vessels and nerves, in order to improve the cleaning. And so you'll see a sonic wave type of machine used as part of the root canal procedure. Some people are also using lasers within the inside of the root canal in order to be able to better clean out the canal, because some of these canals can be curved. And when the canals are curved, then what you're asking is for a very gentle wire which bends and goes along the curve to clean out the entire contents within a curve. And some of these curves can go in two different directions. And so while the endodontist will do a good job doing that, sometimes the technology, for example, the sonic waves, will take care of what might be at the dead end of the curve that you might not reach with an instrument. This will reach with sonic waves instead. It's really neat what's occurred in root canal technology in order to be able to make it more effective.
Neat. Well, so here's two words that I've been waiting to say the whole show, because it's in the notes, and it was so unusual that I thought I have to ask. I would be remiss if I didn't ask. You talk about a rubbery material called Gutta Percha. Am I saying that right?
Yes.
And what is that?
For those of you who are chemists, Gutta Percha is a stereoisomer of rubber. All right. So Gutta Percha has the same chemical composition of rubber, but there are areas where a bond is changed, and so rather than something that's rubbery, you've got something that's malleable and that is soft and that can be compressed in order to be able to seal off that canal effectively. Gutta Percha is the main material that's used to fill a root canal once you've removed all the organic contents. And just as we talked about the fact that the thoroughness of cleaning out the organic contents, the nerve, the blood vessels, and the dead contaminants, the next important thing is, how is that canal sealed? How well is that Gutta Percha sealing against the inside of the canal? How well does that Gutta Percha prevent leakage from the outside of the body into the canal of the tooth, and from the canal of the tooth to the outside? So it's like when you're trying to seal anything, you're trying to seal a windowsill, you're trying to seal a window or something like that. The more thorough the seal, the less the opportunity for water to get in. That's the same principle that we're using when we seal off a root canal. And so you compress that Gutta Percha. You compress it so it fills that canal space entirely, and you even use a little sealer, a little cement sealer, in order to be able to get those areas that we might not be able to compress as well as we might. So the root canal specialist is using both a cement sealer as well as the Gutta Percha in order to be able to seal that tooth off from the outer environment.
Wow. See, more things that we learn by sitting at the feet of an expert. Wow. And although here's the question, because I know we've talked about this a little bit, but, you have impressed me as we've talked about different things over the years. Like I said, all these radio programs, TV programs, Dr. Sheldon, that you've contributed into the Helping Seniors organization, every single one of those is available on our website, on our YouTube channel, on our Facebook page, and you can just go in there and search by topic. Maybe you want to learn about root canal, maybe you want to learn about gum disease, maybe you want to learn about dental implants. All those programs, you could just type it in the search bar and they'll pull right up. But I guess one of the things that you've really impressed on me is it's so important to have good diagnosis so that you know what to do when you're looking at a patient's mouth. And I guess the question that I want to kind of like wrap up our conversation with this on was, how do you then, if you're talking with a patient and examining them, decide, well, we should do a root canal, or no, we need to go ahead and replace the tooth with a dental implant? How do you get to that?
The main thing that I'm looking for, Kerry, is how much of the patient's natural tooth structure remains. In other words, if a tooth is so totally gutted that all there is a root, but nothing that we can see above the gum line that we can restore, then it's more likely that I'll recommend extraction of the tooth. A tooth that's that badly broken down is going to be very difficult to restore, and may not, unless we treat it absolutely correctly, it could crack. So we might spend all that money on a root canal and then do our procedures, and then the tooth breaks off because there was nothing for the crown to grab onto. Then it breaks off. So primarily, it's the restorability of the tooth, our ability to restore that tooth, that will determine whether I'd rather have a root canal done, or recommend a root canal be done, or whether we do a dental implant.
Interesting. Well, I wanted to thank you for sharing all this good information. Again, we're talking with Dr. Lee Sheldon of Sheldon and Furtado, often also referred to as Solid Bite Dental. You have a great website, by the way, that people can access. I believe it's solidbite.com. Am I saying that right?
Solidbite.com. You'll get right to the website. You'll see all three of us.
Yeah, that's right.
And I'm fortunate, I get the opportunity to do the diagnosis here, and I have the opportunity of talking with our patients, and I have two fantastic doctors. Actually, they're my boss now, who do the work. And so we have the opportunity to spend time with you, evaluate you as a patient, and then we have some great people, Dr. Furtado and my son, who can take care of you and take care of the work that needs to be done. But when it comes to root canals, we have two specialists that we work with primarily in our area, that we refer you out to those offices to have root canals done.
Okay, and let's cover one more time before we close out today. Again, this is a fantastic offer, and it actually is a good fundraiser for the Helping Seniors organization. If you want to sit down and have a good comprehensive dental exam, you can do that in a way that actually benefits the work of Helping Seniors. And I want to also, just before we close, mention, Dr. Sheldon, you just did an article actually in the January Helping Seniors newsletter, which is those yellow pages in the center of Senior Scene magazine. It's that free magazine that people love to pick up. It's available at 500 locations around the county. And every month we're in the center of that magazine with good information to help you on your aging plan. And you just finished up actually a two-part series called The Components of a Good Dental Examination. So this would be your, as they say in that movie, be our guest, put our service to the test. How do people get involved in that with you?
And I got to say, I know that people come in for screening examinations. That's not what this is. I mean, you see things advertised come in. No, we would only do this one way. It's a full examination, CT scan, full series of x-rays, everything that I would need for diagnostics, so I can really tell you what's going on. Not to sell you anything, but to tell you what's going on and what I think the different possibilities are in the future. So it's a 2-hour visit in our office. And you just call our office at 321 401-259-8000 and say, I heard Lee Sheldon on Helping Seniors Radio. I want to go in for the Helping Seniors special. And everybody in our office, you'll probably talk with Jennifer, but everybody in our office knows exactly what to do from there.
Absolutely. What a great way to get the new year started. We already talked about in the first half of the show that kind of our underlying theme is getting your ducks in a row for 2022. So what a great place to go. Thank you, Dr. Sheldon, for joining us on the radio today. On behalf of Joe Steckler and our whole team, we'll look forward to seeing you next week right here, Wednesdays 12 noon on 90.3 WEJF. Until then, have a great week.